healthcare workers. However, we are saddened again to report that today we have lost 4 more patients to this disease, and all of them are from Mombasa. And as we previously emphasized numerous times, again a similar situation has occurred out of these 4. They all have underlying conditions such as hypertension, diabetes, and asthma. And therefore, we do call on to all fellow Kenyans who may be having these underlying conditions to ensure that they are managing their conditions well and that they're taking their medications and maintaining healthy lifestyle. We do extend our sincere condolences and sympathies to the bereaved families and friends. Thank you.
Yes, a question from, remember your name and the media house that you represent.
Helen Aura from NTV. Can you confirm that Burundi's First Lady is indeed in the country? And if so, that she's come to receive COVID treatment? Does this mean that this opportunity will also be open to non-dignitaries as well? Or rather, the privilege?
Waiga Mwaura, Citizen TV. Kindly help us clarify some of the numbers that were shared here yesterday. Yesterday we were told there were 692 active cases. 58 people had lost their lives. That comes to 750. And 421 had recovered. That comes to a total of 1,171. Yet you also told us total tests conducted have been 1,618. 447 have not been captured as either having passed on, are in hospital, or have recovered. Where are they?
Purity Musa from KBC. How are you determining that there is indeed, increase in community spread when most of Kenyans know that we are reporting more cases each day, or each time we take more samples than we expect more cases to be reported? Probably you can tell us what exactly are you using to tell you that there is an increase in community spread?
The last one?
Yes, Jimmy Mbogo from K24, and I have a couple of questions. Okay. All right, so number one, we understand that Madam CS, you had promised to give us the figures with regards to how much has been spent and that tabulation, but we are yet to receive that. Number two, the budget is yet to be read, and we just want to know what is the proposal or what is the Ministry of Health looking to get from this budget.
Thank you for your questions, and I'll begin with the last question concerning the expenditure and the figures that we were to share with you. And indeed, this is a process that is underway, and we still remain committed to share these figures with you. The NERC and the COVID Technical Task Force continue to compute, one, the expenditures that have happened thus far, and two, necessary resources that will be required in terms of sustaining the COVID-19 response. And so this will be shared, and most importantly, this will also be articulated in the request when it comes to the budget for the coming financial year, amongst other priorities in the Ministry of Health, including the Universal Health Coverage Agenda. And so I do ask for your patience. Following procedures and protocols, this information shall be shared with you. Regarding, and I think I'll leave Wahiga's question for last because it was perhaps the most mathematical one. I'll get to Purity's question regarding how have we determined that we've established community transmission. When we look back to the genesis of COVID-19 in the country, I think we were able to see that our first initial cases were cases who had had a contact when it came to importation of the disease from people who had come from countries where COVID-19 had been established. And as we shared in several briefings and presentations, we were able to share with you what the link of transmission looks like, highlighting several cases, including case number 44 and many other cases that we've had, and trying to look at what were the contacts of these cases, when were these contacts held, and therefore coming to a determination of whether we've established community transmission in the country. And the DG has been very clear in the past in terms of our incoming positive cases, considering that we've actually stopped incoming flights. It is clear that the disease is now amongst us. And especially when we review our contact tracing data, we're able to actually follow those links and chains. Regarding the question that Helen asked concerning Burundi. One, it's important to note that one, like you rightly said, Kenya is a country that has very good health infrastructure, and we continue to celebrate that and to promote that, including all forms of medical tourism. And this issue is an issue that touches on foreign affairs, and a comprehensive statement will be issued in due course regarding whether we will be able to offer the same service for other Kenyans. However, I can't stand here right now and confirm for you yes or no whether this is the situation. However, Foreign Affairs will be able to give you a statement on this in due course. Regarding the cases and the tallies that we've been having, I'll ask the DG to highlight further into this area. But we do have what we're calling our COVID-19 tracker on our website. And it's a tracker that is able to tell you each day from the first day that we reported our first COVID case to this day, today being the 78th day of our response. We're able to tally what samples did we collect. Out of these samples, how many cases were positive, how many cases were negative. And being very clear to remember that every time we mention a sample, that one patient, one confirmation of a positive or negative case can actually consume more than one test drive. Because there's a protocol that follows, one, to determine if someone is truly positive, and two, if someone is also negative. And so when you see us accounting right now, and I think we have about 70,000 samples run today, this may not necessarily mean that these are 70,000 individuals. And so when you do the basic mathematics of tallying that, it's important to know that there are patients who we've had who've actually consumed up to 4 to 6 tests, and the DG will be able to articulate this. So DG, perhaps, as we add on to more information, kindly jump onto the mathematical question.
Thanks, Madam CS. Wahega, welcome to Africa for your first session with us. Let me just clarify that this is not unique to Kenya alone. We have had challenges even in the developed world in terms of reporting of the cases, because sometimes, as Madam Waziri has said, you have to do multiple tests. And unless you are very keen, sometimes you report a repeat test as a next case. Based on that, we went back to our data bank to be able to mine the data further. As of today, the total number of cases stands as 1,745. Total number of persons admitted in 37 hospitals across the country stands at 671. So you minus that from 1745. Total number of discharges is 438, again minus that from the original figure. Total number of deaths, 62, again minus. There are various patients who are in isolation at home, either because of age or because they are breastfeeding mothers and small children, or they are pregnant women who may not be well managed in a health facility and are asymptomatic. This number stands at 130. Remember, we had evacuees from India who had gone for treatment, and based on our risk profiling, we decided that a given number of them could be managed at home, or we'd follow up by our healthcare workers. So again, take away 130. Then there's this critical group of the people who gave us wrong contacts, whom we are chasing. And you remember Waziri yesterday told you clearly that eventually the long arm of the government will catch up with you. That is 140 persons. Minus that again from the other figure. Then we have a group of foreigners and drivers. Remember when we ramped up testing at the border points, including Amanga, Isebania, in the spirit of East African cooperation, our neighboring countries requested that their nationals, instead of being isolated in a foreign country, they be taken back. That number is 30. That leaves you 274. Out of these 274, today you have reported 127 cases. So these cases are in the process of being admitted into the various isolation units. Together with the 147 yesterday, until we update that data in our contact list, line list at the Emergency Operations Center, because you have to get this data from all over the Republic. So if you minus that 274, the figures balance out well. And I believe you have been doing the math as I highlight these figures to you. So that is a position. Further, to be able to avoid this in future, we have refined our template together with our partners to ensure that we are able to capture this information real time as the data is generated from the counties. And then remember now with the community transmission, the battle shifts from the capital city Nairobi, even though we still report more numbers here at Mombasa, but a significant number of counties now standing at 32 have recorded cases. So as these cases come from the counties, we want to capture that data real time so that our figures continue to add up. Thank you.
One final question for Dr. Moth, if I
Yes,
can. Dr., tell me this. The president recently hinted at substantively reopening the economy. I want to know from you what medical data would inform this reopening. For example, in New Zealand, we know they began reopening after 3 days of 0 positive cases of COVID-19. On June 6th, Kenyans are waiting to hear from the president. What medical data would determine what decisions he'll make?
One of them is what you have highlighted. The other one is total number of cases and many other variables. But we'll be able to give you a comprehensive report on this on Saturday when the National Emergency Response Committee meets. We have been working with our modeling team, the combined University of Nairobi, Jomo Kenyatta, Strathmore University teams, and they have come up with parameters, and it would be premature for me to share that without the authority of the chair of the National Emergency Response Committee. Thank you.
Thank you very much. See you again tomorrow.
Nilikalia pale.